I've been seeing Mr. Schindler for a number of years. Due to some of the issues that he has with his health, it required some additional screening to be done. A CT scan of his chest was done. An incidental finding was noted of an enlargement of his aorta. So we followed up with an ultrasound of his abdominal aorta, and that's when a significant aneurysm was found in his abdomen. Once an aneurysm reaches a certain size, the chance of that aneurysm rupturing increases substantially.
And after they gave me the ultrasound, there was something wrong. And sent me to Dr. Pachera.
He was referred to me because he had a complex aneurysm. We tried to educate him about how the best way to treat aneurysms. But in his case, he was a good candidate for what we call a custom-made stent to treat his aneurysm. The aneurysm is ballooning of the aorta. The most common location is in the abdomen below the kidney arteries. And what happens is that when the aneurysm dilates, the wall gets thin, and then over time it might rupture, and most patients unfortunately will bleed to death and will not make it to the hospital. So based on the size, we recommend treating these aneurysms. We go through the groins and we put a stent in the aneurysm, and then also in Mr. Schindler's case, we had to move a little bit higher with the stent so we can land in healthy tissue so that seals, it doesn't move or migrate. But then we had to also make it with holes in it so we can preserve the circulation to the small bowel and the kidneys. And that's what we call custom-made stent. The stent is made of covered fabrics, so now the blood goes through the stent. It doesn't make any contact with the aneurysm wall. He did really well, minimal pain after surgery, and went home the next day. And we follow them long-term just to make sure the stents are okay, they're patent, which means there's still flow in the kidney arteries and the small bowel.
He saved my life. Him, my primary doctor. My primary doctor wasn't going to give up on me finding out what was wrong with me.
There are certain criteria that we recommend screening for aneurysms, particularly white male, above the age of 65, family history of aneurysm, and smokers. The primary care physician can actually screen these patients for aneurysms too.
One of the benefits of being a primary care doctor at Loyola is having such a great network of specialists, so readily available and so accommodating to see our patients.
I'm very proud of our program. We really have taken on some challenging cases, and we've had great successes like Mr. Schindler, and the reason for that is we have a good team. We've had some really excellent results.